the last topic, and that is related to the reproductive system. And as usual, we are here to discuss according to our manual. Whatever is written here, we should have to concentrate on the things, not leaving anything from inside and not going beyond. So today's learning objectives would be the major components of male genital tract, the major features of each component of male genital tract, the major components of female genital tract, and the major features of each component of female genital tract. So accordingly, we should have to go further. We divided the system into two, the male and the female. Okay, and for those we have the same tables, like we divided into external genitalia, internal organs for both male and female. Now, the external genitalia are, we are now discussing the male reproductive system. In external genitalia, we have to include the penis, the spermatic cord, the scrotum. In the internal organs, we have to include the testes, the excretory ducts, the accessory glands, the spermatic cord. Again, the spermatic cord is given here, but as part of the spermatic cord is lying outside of our body. So that is also included in the external, and part of it is lying within the inguinal canal, within the inside, so that will be included in the internal part. Now, first they start with the penis, and that is, give me this one. Okay. Identify first the structures. This is urinary bladder. This is the rectum and the anal canal. This is below to the urinary bladder, at the base of it lies the prostate. Okay. On the back side, posteriorly, we have two seminal vesicles. Two seminal vesicles. Here, the two ureters which are coming from above. As I told you, there are two ducts closely related to the urinary bladder. One of it, which is coming from above, could be the ureter, and the other, which is traversing from all the way around and going posteriorly, that is the vas deferens or ductus deferens. This structure, which is lying below to the urinary bladder, is the prostate gland. Okay. Now, these structures, the testicles, along with its ducts, with the spermatic cords, they are outside. The penis, along with its, a portion of this part of the penis lie inside the body, and this part is outside the body. So definitely it has got the root and the shaft and the glans. Okay. Now, after understanding the gross features, now let's discuss one by one. The penis is purposing two functions in males, both the transmission of the urine through it, urethra is present inside, urine is passed through it, and the seminal fluid is passed through it. Okay, both. In contrary, with the female side, we have we will see two structures. One is the urethra, which is specific for the urine, and the other is vagina, which is the birth canal or the sex tract. Okay. Now, the penis has got the shaft. It is comprising of inside, it is comprising of erectile tissue, which is present, you can see here in this sagittal section. This is the corpus cavernosum, which is shorter than another structure which is lying below, corpus spongiosum. So the corpus spongiosum is very long. It is going up to its root, and the corpus cavernosum is lying above, and it is short. The corpus cavernosum, it bears within it the artery. Each corpus cavernosum is having artery within it, and with the corpus spongiosum we have urethra in it. So as we discussed in the portion of the urinary system, the spongy urethra, which is present in this part, that is, the name is given by because this part is present in the corpus spongiosum. So that's why it is called penile part or the spongy part. Okay. Now this structure, this part is responsible for the erection in males. Corpus cavernosum. It is within it the blood vessels are engorged, and it is deficient up to here. It is marked up to here. And this part, which is expanded anterior, this is called the glans penis, that is the continuation of corpus spongiosum here. As urethra is the internal structure which is present within it, so the corpus spongiosum is present. It contains urethra in the midline. So if we see the cross section, we will see like this structure. You can see here on the top is corpus cavernosum. Within the center lie the artery, and in the base the corpus spongiosum. Right? This is corpus spongiosum, within which the urethra is present. Surrounded by the skin, the blood vessels, the nerves, all are the accompaniment which are present here. Okay. So, right. External urethral meatus. The external urethral meatus is the structure. External urethral meatus is the opening of the urethra outside. Okay? This urethra is opened outside as an external opening, which is called external urethral meatus. So, okay. Now, one thing which we have to see that in case of males, the testes, they are lying outside the body. Whereas in case of females, the ovaries, they are present inside the pelvis, inside the body. Why? Why the testes lying?
Because of the temperature.
Because of temperature. The testes require how much deficient temperature to work well?
24, 25.
No, 35.
35.
35.
Around 2 degrees less than the core inside body temperature. If the body temperature is 37,
35.
that it needs 35. Whereas the females, the ovaries, they lie inside. Why? Why the females, the ovaries lie inside? Why?
Body temperature.
They doesn't have any correlation with the temperature
No,
to work well?
they want.
No need. No need. Why?
Because it needs to go into the uterus.
It needs to
Go through the fallopian tubes into the uterus. So it wouldn't make sense to be outside.
Denaturation? Denaturation?
mature.
Like in the sperm, it will denature because of the heat, maybe, but the eggs not. They do not denature.
Any other? You see, what happens? In case of females, when the baby girl born within the womb of the mother, last final days, you see, at the same time, the number of oocytes, primary oocytes, which are responsible for further up to the age of menopause, whatever the primary cells are needed, they all are present in the ovaries. No other, okay? Nothing other, okay? And in case of male, the spermatids or spermatogonia, the sperms are producing within the seminiferous tubules. Within the testis, you can see here. Let me show you this one. This is the section, longitudinal section. Here, the testis is divided into lobules by the core of tunica albuginea, which divides into lobules. So within the lobules lies seminiferous tubules. The seminiferous tubules are coiled tubes, and these tubes, they are responsible for production of sperms. So that needs less temperature, but in the female, all cells are present already. Okay? Right. Only they needs maturation. That doesn't have any correlation with the temperature. Okay. Now,
There's still one in the penis at the end, the prepuce.
prepuce. Prepuce is the structure, you see, this is the glans penis, okay? This is the foreskin, which is present outside before circumcision. When in Muslims and Christians, we usually incise this extracts. So that will be excised and the glans will be opened, right? So, so you see here, this part is inside, this area would be inside, and this is outside. So this is the part which is closely related, that is the junction between the root and inside and the outside. This area is the pubic bone. This is pubic bone. So this is lying outside. So some part of the penis lie outside, most of the part lie inside. Okay. Now the thing which is, we are going to go further. I was discussing about the scrotum. Scrotum is the skin which is lying below your pubic area. Okay? This skin is containing, it's a sac, scrotal sac, which is containing testicles along with its ducts. So if we go like this, more clearer in this specimen, right? These are oval testicles, one in each part of the scrotal sac present, and the testicles, they are covered by a layer of fibrous tissue which is called tunica albuginea. Tunica albuginea. On the top of it, you find tube which is lying above and posterior to this, and this is called epididymis. Epididymis. Okay. The epididymis has certain parts, and it goes downwards behind the testis, and then it moves up as vas deferens. So this is vas deferens. Okay. This is vas deferens, and the other structures which make up the spermatic cord, they are all, if we ask you to identify the whole structure, your answer would be spermatic cord. And if we ask you to identify this structure, your answer would be
Vas deferens.
vas deferens. Okay. Now, if we incise this, if we make a section of the testis, what you will see? You will see the outer is being incorporated by tunica albuginea, and the tunica albuginea is throwing into compartments. It divides the testis into compartments. These compartments are called the lobules of the testis. Within the lobules lie, in these spaces, what are the tubes?
Seminiferous.
Seminiferous tubules. So the seminiferous tubules, they are present all in these areas. These seminiferous tubules, they go inside into a network of tubules, and that network of tubules is called rete testis or rete testis. Rete testis leads to efferent ductules not present in this model, but it ultimately opens into the epididymis above. Okay? Then I told you that the epididymis leads to the vas deferens, and vas deferens leads to further swallow. Okay. Now, the skin of the scrotum is outside. We have same skin which is present in the abdominal wall. Behind that we have different layers. For example, if we have superficial fascia, dartos muscles, external spermatic fascia, cremastic fascia, internal spermatic fascia, and tunica vaginalis. Okay, one by one. Do you have a section of in your tablet? Section of the
Yes.
because we don't have any model for that. Okay.
No, no, you can.
Now you see that here outer the skin, and these are the different layers inside. Most outer the skin, and below within the skin lie the no
Superficial fascia. Below the skin, superficial fascia مع dartos.
superficial fascia is present below the skin. Within the skin, before the superficial fascia, layer of muscles is present, and
Dartos.
that muscle is called
Dartos muscle.
dartos muscles. So here the dartos muscles are embedded within the skin, right? And there's another muscle which is present in the layers, and that is called the cremastic muscle. Cremastic muscle. This cremastic muscle is this one. If you make it broad, this is cremastic muscle. Okay? This is the external spermatic fascia. This is the superficial fascia containing dartos muscle, which is lying below this skin. Okay? Cremastic muscle, and below the cremastic muscle lies the internal spermatic fascia. From where, what is the source of these fascia? What is the composition of the anterior abdominal wall muscles?
Peritoneum?
No, anterior abdominal wall.
Interior.
Anterior. What are the layers of anterior abdominal wall?
Oh, the external muscle,
Hmm?
the external, internal, and
Anyone?
transverse oblique.
Most superficial is which muscle in the anterior abdominal wall? You?
Interior.
Most anterior?
Most anterior.
External.
Transverse? Transverse?
Transversus abdominis is most interior.
That's two.
External oblique.
You are giving me answer. Shabab, listen. External oblique is the muscle which is the most superficial one. In the anterior, there are two pillars of rectus abdominis. Most common, 6 packs for the bodybuilders. External oblique. Then we have internal oblique. The fibers are going in reverse directions. This is going like this, and internal oblique is going above. Okay. Then we have most internal, which you are telling me is the transversus abdominis, which is most interior. Okay. So there are external oblique, internal oblique, transversus abdominis, and in between two central pillars, which are the rectus abdominis. Okay. The side, this is the part which is delivering through the inguinal canal the structures of the spermatic cord. The story is the testes at the time of initial phase of development. The whole pelvic size is like a size of a pea seed. Okay? and the testis is attached inferiorly with the fibrous structure which is called gubernaculum testis. Gubernaculum testis. Okay. With the increase in the transverse diameter, with the increase in the longitudinal diameter, that gubernaculum testis, which is related to the testis, is not increased with the time. It remains same. 5 millimeter is the length of it. Only 5 millimeter. So testes lie initially in this area, posterior abdominal. With the increase in the length, the increase in the horizontal diameter, this is going to be descent. Going to descend because the gubernaculum, which is attached to this part of the skin inside, is retracting the testes down. Okay, so that this will be increased, so that is going to be down, going inside, below. Okay, so this I told you that these all structures, they lie behind the parietal peritoneum. So with the descent, some part of the peritoneum also descends down along with the testes. Through which passage? Through the passage of inguinal canal. Inguinal canal is nothing, it is the passage which is continuous. Inside we have the deep inguinal ring. Outside this area is the superficial inguinal. This is the superficial inguinal ring. And this is traversing through this passage. Right? So this is the superficial ring. From all these structures, they are traversing through the inguinal canal, going down to have a location here. Okay. So the part of the peritoneum which is moving down along with the descent of the testis, that is the tunica vaginalis. Tunica vaginalis. There are two tunicas present within it. One is tunica albuginea, the other is tunica vaginalis. Tunica vaginalis is this area. You see here, this dark area. Can you see it? U shape. This is moving down due to the retraction of the gubernaculum. It descends down along with the testis. Okay? I told you tunica albuginea is making the outer coat which divides into septa. Septa gives lobules. But tunica vaginalis is the part of the peritoneum which is moving down with the descent of the testis. Okay. What are the layers remaining? From outside, if you go inward, we have skin, the superficial fascia. Within this fascia lie the dartos muscles. This dartos muscles are responsible for making the skin of the scrotum wrinkled. The skin of the scrotum is not smooth like the skin over here. This is wrinkled. So, what is the purpose of dartos muscles? Any idea why they are present?
So modify temperature.
Outer temperature? No. Temperature modification is the role of another muscle, which I already told you, cremastic. I'll discuss it with you afterwards. What is the purpose of dartos muscles? I told you that it makes the skin wrinkled, so it has extra skin in this area. In case of sexual arousal with the erection, this extra skin will go up in the penile area. It is utilized by the penis during erection. Okay, so the dartos wrinkles and gives the skin to the penile area. This is the purpose of dartos muscles. Now we have from the external oblique muscle here anteriorly, external oblique gives rise to external spermatic fascia, outside fascia. Okay, oblique gives rise to cremastic muscle. Second, the transversus abdominis fascia gives rise to the most internal, that is called the internal spermatic fascia. 3 layers. Okay, external oblique gives rise to external spermatic fascia, which is present in your book, in your tablet, in your figures. So these layers, they are nothing but they are the derivatives of the layers of the anterior-abdominal wall muscles, right? So external oblique gives rise to external spermatic fascia. Number 2, internal oblique gives rise to cremastic muscle. Okay. Third thing is transversus abdominis fascia, which is lying most posterior to the transversus abdominis muscle, that gives rise to internal spermatic fascia. So these layers are formed of the scrotal wall, right? So they are mentioned over here: skin, superficial fascia, along with dartos muscles, external spermatic fascia, cremastic muscle and fascia, internal spermatic fascia, and tunica vaginalis. All are, we have done it. Unfortunately, we don't have a big model to explore the layers of the scrotum, so we give it to you through the diagram. Okay. What are the contents of the spermatic cord? Assume the testis is inside. It has to go out.
That's different.
Okay. First of all, testis. Testis going down, which is present in the scrotum, that gives rise to epididymis. Epididymis continues as vas deferens or ductus deferens. Okay. Along with the ductus deferens, we have arteries, testicular artery, testicular vein. Okay. The nerve is going to the testis, and the pampiniform plexus. Right. So, first component is these two blood vessels. You see how, from where they are originating. They are originating from here. So, testicular artery and testicular vein, they are going through the same passage through the deep ring, inguinal canal, superficial ring, entering into the scrotal sac. Right? Number 2, ductus deferens. The ductus deferens, I told you previously, here you will find two tubes. One would be horizontal, vertical, and the other should be horizontal, which makes exactly 90-degree angle with each other. So this vertical tube is ureter, and this tube which is coming, this is coming from top, and this is coming from below. So this is called vas deferens or ductus deferens. Okay, the blood vessels are here. So for identification, if we ask you to identify this one, your answer would be ductus deferens or vas deferens. If we ask you to identify whole structure, it's spermatic, right? Okay.
The
Yes.
A structure is the prostate gland.
Prostate.
The A structure.
Yes. This is a prostate gland. Yeah. This is, you see, not normal. The size, the volume of a normal prostate is 30 ml. When it crosses the limit of 30 ml, it will be considered as enlarged prostate. So it is more than 50 ml. This is something, you see, abnormal. Okay? So, right. So the first table, which deals with the external genitalia, we have finished it. Remaining things are related to the internal organs. Out of those, we already discussed some part of the testes. Okay? And what is that? Capsule, which is made by tunica albuginea. Okay? Mind one thing, the ovaries are also being covered by tunica albuginea. Same. Okay. Seminiferous tubules, ratty testes, efferent ductules. Now, second is accessory glands. What is the meaning of accessory? What is accessory?
Not necessary.
So these are extra.
It's
Supportive.
yeah. Facilitates.
To some extent, you can say.
You could live without.
Not vital.
You see, if I ask you to perform any job, there are two ways. Either half-heartedly do that work, or with full intention. With your full, you see, intention, you have to do it like this. So accessory means the structures which which are aiding the primary structures, which are helpful for the primary organs. Okay, so these are the accessory glands which are present to modulate the actual thing. So they are called accessory. In the accessory, we have to include prostate gland, seminal vesicle, and bulbourethral glands. Three things. Prostate, you saw, this is the sagittal section. This is the prostate, lying below the urinary bladder, above the bulb of the penis, above the urogenital diaphragm. So this is prostate. This is the inside view of the prostate gland, which is lying below the urinary bladder. Okay. Now, at the level of this urogenital diaphragm, there are two bulbourethral glands exactly at this level, which pour their ducts into the membranous part of the urethra. The membranous part of the urethra. You know very well the parts of the urethra.
Yeah, three parts.
What are those?
The
Prostatic, membranous, and spongy part. So that is going to the membranous part of the urethra. This is prostate. This is second thing. Third thing is seminal vesicle. This could be more clear in this model. You can see here. This is the urinary bladder. This is the seminal vesicle.
So at the end of the
Seminal vesicle. Seminal vesicle, if you make a section on the other side, this section is like this. So this is seminal vesicle. On the top, this, if you make a section, on the top is the ductus deferens. So these two are separate structures. These two are separate structures. If we mark over here, your answer would be seminal vesicle. If we mark over here, the answer would be vas deferens or ductus deferens. Okay. So 1, 2, and 3 structures. What are the purposes? Seminal vesicles. What are their role?
to produce
Seminal fluid.
seminal fluid.
Seminal fluid.
Seminal fluid? What does it contain? What does it contain?
Seminal fluid.
Provides the, I know it provides the most amount of seminal fluid.
Okay, but tell me the purpose. What is their role? Why they are present? I told you they are helpful. They are aiding the primary structure. What aid they are going to provide?
Keep the semen, sperm alive.
Yes. In some sense, you can say. Okay. Let me tell you. Number one, fructose. Fructose. Fructose is sugar. Okay. This fructose is responsible for utilization of the mitochondria, which is present within the sperms. ATP is produced. Okay, by this sugar, ATP is produced, and that leads to the mitochondria, which is utilizing ATP for the movement of the flagellum for the sperm. Okay. Number two, prostaglandins. Prostaglandins. This is something deviating, but this will give you concept about what a seminal vesicle is. What is its role? Prostaglandins is responsible for ejaculation or the contraction of the tract. And when the semen gets deposited within the female genitalia, the contraction of the vagina, the cervix, the uterus, that is its role, okay, for propagation forward. Right? Fructose and prostaglandins. They are responsible for this role, okay? Right. The bulbourethral glands, they are responsible for moistening the tract. Right? Prostate, it causes decrease in the pH of the urinary tract to avoid infections. to avoid any infection of the tract. Okay, so this is their role. Got it? Prostate. Prostate is, if you make a section of this, you can see this is the cone-shaped structure. This is the base, which is lying below the bladder, and this is the apex. Okay. Within the prostate, you find two things. This is the prostatic part of the urethra, starting from here to here, right? What is this part?
Ejaculatory duct.
Ejaculatory duct. The ejaculatory duct, this is the vas deferens, this is seminal vesicle. Seminal vesicle, it leads to a duct, and this vas deferens, when it unites with the duct of the seminal vesicle, it becomes ejaculatory duct. So two ducts are responsible for the formation of ejaculatory duct. One is the duct of the seminal vesicle, the other is the duct of the seminal vesicle, and the other is the duct of the vas deferens. So this is ejaculatory duct. Okay, this is prostatic urethra.
What is the ejaculatory duct?
Ejaculatory duct is this small structure, right? In the other model, which is very different, this is the urethra within the wall of the bladder, prostate. This is prostatic urethra, and this is ejaculatory duct. Okay. Now, if you see on the other side, this is seminal vesicle, and this is vas deferens. And what is this?
Spermatic cord.
What is this?
Spermatic cord.
Have you done the urinary system?
It's not the ureter.
Ureter. Ureter.
No. Urethra comes from above.
Yes, where it is going? It is very short. Is it not going upwards direction? What is the anatomical position? This is an anatomical position. You see, from here it is going down up. So be careful in identifying the structures. In this model, okay? For example, I'll show you like this, for example. Okay. This is the female structures. This is the ureter. What is this?
Bladder.
Bladder?
Uterus?
Uterus?
No. Peritoneum. Peritoneum.
Peritoneum. This is peritoneum. Which are part of the peritoneum? Have you done urinary system?
I wasn't here when I did it.
Huh?
I wasn't here when I did it.
You are outside Saudi Arabia?
No, I was sick.
You were sick?
Yes.
You didn't attend urinary system?
No.
You? You are also sick?
I wasn't paying attention.
Huh?
I wasn't paying attention.
Oh. Yes. What is this? Peritoneum. Listen. Listen. In the beginning, what I told you, all the urinary structures, they are lying behind the peritoneum. What is the anatomical position? Show me the anatomical position of this.
You want to show that?
No, no, no. No, no. You show me. In order to identify the structures in OSPI, one should have to do one thing, which is very important. And that is to keep the structures in anatomical position.
كذا
Yes?
كذا كذا.
You? What's your name?
Rakan.
Rakan? Rakan. Rakan, show me the anatomical position.
This is the interior part.
Yes. Give it to me. This is, yes, excellent. So he's telling me that this is the apex, okay? This is the apex, and the apex of the urinary bladder must be in front. So this is in front, this is pubic bone. You should have to keep the pubic bone in front, keeping the apex in front. So this structure is the peritoneum, parietal peritoneum. See, if it is parietal peritoneum, so all is peritoneum, so see the ureter is behind it. This is peritoneum in front, so that is behind it. Why the ureter is going within the true pelvis in this compressed way? Why it is not straight? Due to the peritoneum, excellent. Due to the peritoneum, this all peritoneum pushes the ureter and the structures behind. And not only this, in the pelvis, the parietal peritoneum is pushing the ureter backwards. So that's why this is the main, I told you, this is the main point to identify. And the other point of identification of ureter is?
The external
Yes,
iliac
yes,
vein.
yes.
External vein.
Yes. The another point of identification, especially for this plastinated. Plastic is very easy. Red artery, blue vein, green ureter, and this like this, boom, very easy. But in case of plastinated, when it comes in the OSPE, what will you do? You see, students usually they commit mistake in identifying the plastinated. Okay, so this is the anatomical position. Okay, now these are the two vessels. One is artery, and the other is vein. This, what is this structure? Ureter, and that ureter is crossing the, maybe in front of the common iliac artery, or maybe its division, external iliac artery. Both are the conditions. In some models, you will see the ureter will cross the common iliac artery. In other model, you will see ureter is crossing the common iliac artery. See, and in this model, for example, here, this is the common iliac artery, this is the internal iliac artery, this is the external iliac artery. So it is crossing the external iliac artery. Okay. Now, this is ductus deferens, this is ureter, which is lying behind the peritoneum. Okay. What we were discussing? Yes. The prostate. Prostate is conical in shape. This is the base. This is its apex. And these tubes, they divide the substance, the parenchyma of the prostate into lobes. Tell me one thing, what you expect, how many ejaculatory ducts would be present within the prostate?
One. No, two.
You see, what I told you, vas deferens above, seminal vesicles below, seminal vesicles give rise to duct. Vas deferens unites with the seminal duct of the seminal vesicle to become ejaculatory duct. Two ejaculatory ducts, one on each side. They enter into the substance of the prostate gland. And where they open? They open into the prostatic part of the urethra. Okay? Prostatic part. Got it? Okay. The prostatic part of the urethra, right? Okay. So, what is the location of the prostate? The prostate is lying inferior to the urinary bladder. within the true pelvis, within the pelvis. So manual vesicles done, bulbourethral glands. I told you that this is lying at the level of the urogenital diaphragm. Okay. Excretory ducts, epididymis. Yes, epididymis is this is the superficial layer. After removing the cremastic fascia, you will be able to enter into the cavity of the scrotum. Okay, the tunica vaginalis, the cavity, and then the testes. Right. So when you explore it, you will go inside. And what are the things which you will find? This structure. Cremastic fascia is removed. Cremastic muscle is removed. Now you will be able to see the pampiniform plexus of the veins, the vessel, artery, and the nerve accompanying all inside, along with the vas deferens. Okay. And now this is the testicle. Okay. This is epididymis. This is the head of the epididymis. This is the body of the epididymis. This is the tail of the epididymis. The tail makes a kink, acute curve, and that goes upward as
Vas deferens.
vas deferens. Okay? Right? So this is about the okay. Before entering into the before entering and uniting with the duct of the seminal vesicle, this area gets enlarged, dilated, the terminal part of the vas deferens, and that is called ampulla. This is the ampulla. They have made a section through the ampulla of the vas deferens, right? Okay. So in the heading of excretory ducts, we have epididymis, head, body, and tail. Then we have vas deferens, ampulla, and ejaculatory ducts. Now you can understand where is the location of ejaculatory duct. Okay? Right. So as a quick review, because we have too much time. Tell me one by one, okay? Tell me the layers of the scrotum.
Skin, then the superficial fascia with the dorsal muscle, and then external spermatic fascia, then cremasteric fascia, and then internal spermatic fascia, and then the visceral layer. The tunica vaginalis, and then the tunica albina, which makes the capsule. Albigina, which makes the capsule. Then you have the lobules and the seminiferous tubules, which open into the reti testes, which go into the efferent tube, which go into the epididymis, the head, and then it goes into the vas deferens, and then the vas deferens.
Head, body, and tail.
Yeah, and then open into the vas deferens. Vas deferens goes all the way up to the prostate, which near the prostate, which opens into the duct of the
all the way around the urinary bladder.
Yeah, into the
and behind it opens into
the ejaculatory duct, which is a part of the seminal
the duct of the vas deferens. Okay.
and then opens into the prostatic part of the urethra. Prostatic part of the urethra continues on through the corpus spongium, spongiosum, which has the corpora, the erectile part. Corpora. the erectile.
Corpus cavernous.
الثاني, the erectile part of the penis. Corpora.
No. The urethra never.
No, I mean after the, like, you have the corpora spongiosum, then you have above it part.
But it is above. It is separate. It has no link with the urethra.
Yeah, urethra only goes through the corpus.
Urethra
above
goes,
the spongiosum.
yes. Above are the corpus cavernous. Okay, fine. So, right. Now the female genital tract, right? Female genitalia. First, like the male organs, the female organ, external genitalia. this is the pelvis. Okay. Pelvis is, this upper part is called the false pelvis, and below, all surrounded by the bones, is called true pelvis. This is true pelvis, this is false pelvis. This is the pubic symphysis. Two pubic bones come together to make a joint, which is called pubic symphysis. Right in front of the pubic symphysis, there is the part of the skin which is having some fatty tissue, and that area is called mons pubis. Mons pubis in females. Okay. Now, if you go downwards, then you will see there is an opening between the labia minora, two clefts of skin, labia minora. Okay, these are very thin clefts of skin and surrounded by two
labia majora.
thick labia majora. Okay, and here within this cleft, the most superior part is knob-like. This is clitoris, which is sensitive to for the sex. Okay, below to it lie urethral meatus, external urethral orifice, urethra, and below the urethra, vagina, which is the birth canal. Okay, and all the lowermost is the anal orifice. So this is the anal region, this is genitourinary region. I told you in the males we have only one duct serving both purposes, but in females there are two separate ducts. One is for delivering urine through the urethra, and the other is for birth canal for reproduction. Okay. Now this is about the external. Now, greater and lesser vestibular. In this vestibular area inside, we will see the vestibular glands present, which are responsible for moistening of the tract to decrease the friction. Okay. Now, in the internal organs, what are the structures which we are going to study? Ovaries. Number 2, uterus. Number 3, uterine tube. Number 4, vagina. Okay. Ovaries. Ovaries are, you can see here in this order. These are the two ovaries. Okay. They lie in the true pelvis inside, and these ovaries, they are connected to the midline sac, that is by the ovarian ligament. This is ovarian ligament, and here there are other tubes closely related to the previous one, are fallopian tubes. These are the fallopian tubes, these are the two ovarian ligaments. Okay. Now, as I told you that the urinary structures, they lie behind the peritoneum. If urinary bladder is like here, for example, in case of male, if urinary bladder is here, so that is definitely the superior surface is being covered by peritoneum. But this part where the ureter is opening is devoid of peritoneum. It is not having peritoneum. Okay? Okay, right. So this is the inferior surface. This is superior surface. And this is the border which divides the superior surface with the inferior surface. Okay. This is exactly found at the edge of the border below the peritoneum. Right? Now, in case of females, first skin, then the pubic symphysis. After that, urinary bladder. Urinary bladder. Behind urinary bladder is the uterus, and behind uterus is the rectum and anal canal, and then sacrum and so on. So this is the position. So in case of this sagittal section, what you will see, this is the skin, the pubic symphysis, pubic bone. Behind pubic bone is urinary bladder, which is leading to the membranous urethra, and behind the urinary bladder lies the uterus. Uterus leads to vagina, which is opening into, this is the external genitalia, this is labia minora, this is labia majora. Two clefts. Labia minora, labia majora. Okay. And behind this is the rectum and anal canal. Okay? Right? Now, in other model, you will see like this. What is the difference between these two models? Yes. Excellent. This cavity is opened. This cavity is opened. And when it will be opened? Two occasions. Just before menses, before the periods in the females, when the cavity is filled up with the blood and this dispermated endometrium of the uterus, uterine wall. Number two, when the female gets pregnant. Otherwise, this cavity is slit-like. It's closed. Slit-like. That is the main difference between urinary bladder and the uterus you will find in the plastinated model. In the plastinated, that is the only difference through which, and the location. Urinary bladder should be more anterior than the uterus, than rectum. This is the first point to identify. Number two, all the time the cavity of the urinary bladder will be opened, even just after voiding urine. Just after voiding urine. That is opened. But here all the time the cavity is closed. So in this model, urinary bladder. But in case of female structure, like here in this section, we have, this is the uterus. This is uterus. And this is urinary bladder. The urinary bladder leads to urethra, the membranous part of the urethra. The uterus leads to vagina, which is leading to the exterior. Labia minora, labia majora. Okay? So these are the structures which will have to identify, that will give you, aid you in identifying these organs in plastic. Shabab, please. Silence, please. Okay. So, okay. Now, there is a question which arises: the difference between the identification of uterine tube and the ovarian ligament in plastinated and plastic both. How would you identify the ovarian ligament? How would you differentiate with the fallopian tube? For example, I am giving you the example in this. First, the gross structures. This is uterus. This is the part of the vagina, most superior. This is urinary bladder. Okay. Now, this yellow colored structure is ovary. And on the top of it, finger-like projections. These are the fimbriated end of the fallopian tubes. Okay. Now see, there are two tubes running close together, very close. You have to decide which one is fallopian tube and which one is ovarian ligament. Okay. So how would you identify which is?
The fallopian is larger with the projections, and the ligament goes down below close to the ovary.
Yeah. Okay. Now tell me, in this scenario, which would be the ovarian ligament and which would be the fallopian tube?
One behind.
If you have any doubt, yes. Yeah. If you have any doubt, this is my advice: just to rotate the specimen. or if in one position, if you are in doubt, then you will have to see through other view. Okay. So if there is a doubt, this is fallopian tube. You see, if in this view, it's quite obvious that this part is going to the fallopian fimbriated end. This is fallopian tube, and the other one is naturally ovarian ligament. What is the purpose of ovarian ligament? Does it have any cavity inside? No. What is its purpose?
Hold it in position. Hold the ovary.
Hold the ovary in its position into the pelvis, so that it retracts the two ovaries in the midline, and the another structure is the suspensory ligament of the ovary, which is again in the fold of the peritoneum within the pelvis, and it is coming from above and it holds it. I'll show you which one is the suspensory ligament. Show me please. First, the big structures. Uterus, ovary of right side, ovary of left side. This ovary is attached to the uterus by ovarian ligament. This is ovarian ligament. This is fallopian tube, which is ending into the fimbria, fimbriated end. Okay? Now, this structure, which is coming from above, it gives support, it pulls the ovaries above. So this is called suspensory ligament, through which the blood vessels make their way into the ovary. These blood vessels, arteries and veins, they go inside of the pelvis to enter into the ovaries through the suspensory ligaments. Okay, behind the suspensory ligament. So, and the next thing is this area, this part, which is anterior and posterior. This area is called the broad ligament of the uterus. Broad ligament of the uterus. Fallopian tube is this one, and this is the fimbria. Yeah.
How do I differentiate?
I tell you, ovary. This is ovarian ligament, and the other is entirely separate, ending into the finger-like. Okay. Okay. Now,
Especially the tube goes with the ovary, as ovarian.
fallopian tube is separate, and the ovarian ligament is separate. Fallopian tube is a tube which is having a hollow cavity inside. This area, it receives the ovum. From this area, the ovum goes into the fallopian tube, and then when it is fertilized, it fertilized over here, and then it enters into the uterine cavity to be embedded for conception. Okay. Now, this is the structure which is lying on the sides, which holds the uterus in its position. It is support. It is for support for the uterus. This is called broad ligament. Broad ligament is again this velvety parietal layer which is going from above downwards. First cover the uterus, then covers the parts of the fallopian tube. This, for example, this finger-like projection is the fimbria. Then this dilated area is the infundibulum. Infundibulum leads to ampulla. Ampulla leads to isthmus. Isthmus leads to intramural part within the uterus. These are the things. Okay. Now the most lateral part is the fimbria. We don't include fimbria into the parts of the fallopian tube. It is the part of the infundibulum, projected finger-like projection coming out from the infundibulum. After that, the infundibulum, then ampulla, then isthmus. Okay. Now let me show you in this model. Very clear. So if we ask you to identify ampulla or infundibulum or isthmus, we will ask you definitely in this one. Very clear. Okay. So this is the fimbria. This is infundibulum. This is ampulla. This is isthmus. Ampulla is wider, isthmus is narrow, and then it leads to the intramural part within the myometrium of the uterus. So these are the different parts of the uterine tube. Okay. The location of uterus is within the pelvis. It is highly muscular organ. If you see, both are very muscular. They are remain in the pelvis, but in case of pregnancy, they may reach, the uterus may reach up to this level. Okay? So, see how strong its muscular walls are to carry this load. So, this is the location, layers of the wall. What are the layers of the uterine wall? This is only for theoretical purpose. The outer layer is called uterine wall. How many layers? Peritoneum is the serosa which covers it. Yes?
Endometrium, myometrium, and I just know these two.
Serosa and serosa. Serosa.
Outer layer, serosa. 3 layers?
3 layers. 3 layers. The most inner is the endometrium, the thick myometrium, and the perimetrium, which is the outer. Okay? Okay.
Is the perimetrium serosa, they say?
Yes. Okay. Now after that we have. Okay. Consider this specimen. Maybe that could be helpful for you. This is uterus. The area on the top is dome shaped.
Fundus.
This is called fundus. Fundus lie up to the level where uterine tube opens. Above the opening of the uterine tube, this is fundus. Below to it would be the body. And body leads to the neck, the cervical part. If you have a section, then you can see here, this is fundus, this is body, this is the neck, cervix. Cervix projects into the upper part of the vagina, okay? And it has got 3 things which have been written, I think, in your manual. The internal os, external os, and the cervical canal. So the os which is opening inside is called the internal os of the cervix. The os which is opening into the cavity of the vagina is called the external os. Between these 2 openings lies the cervical canal. Okay? So if we ask you to identify like this, you can. Vagina. This is making a flexed position. You see? This is the longitudinal axis of the uterus. This is the longitudinal axis of the vagina. This is making a flexed position. So vagina is lying below the cervix. Here you can see 2 projections around the cervix. These projections are called the fornices. Fornix is singular, fornices are plural. So this is the posterior fornix, this is the anterior fornix, likewise lateral fornices. So that is cervix lie in the center, surrounded by invaginations. These invaginations are called fornices. 1, 2, 3. Function is deposition of semen at the time of ejaculation. Here the seminal fluid gets deposited and when it contracts, by the effect of prostaglandins, what I told you.
طيب كذا ما تسوي سيف.
Now,
ما تسوي سيف. دق الدنيا.
now let's identify the structures in this plastinated. Okay? better to keep it overhead. Right? Male, female. On the top,
urinary bladder.
urinary bladder. What is
Prostate.
this?
Prostate gland.
The pubic bone.
لا لا.
Prostate is different from urinary bladder.
okay.
This is pubic. I told you so many times. First skin, pubic bone, pubic symphysis. Okay. Pubic bone. This is urinary bladder. Here, prostate. This is the limit of the prostate.
Okay.
So the part of the duct which is present within it is prostatic urethra. This is prostatic urethra. And below to it is the membranous urethra. Then this is the bulb of the penis. Bulb of the penis. And here urethra spongy part. Corpus spongiosum. This is the urethral meatus. Okay, external. And this is corpus cavernosum. Okay? What is this tube? Vast difference. Vast difference. Ureter is this one. Vast difference. Okay? This is the ampulla of the vas deferens. Can you see it?
Yes.
Dilated area. Most proximal area. And this is seminal vesicle behind. Okay? Ampulla, seminal vesicle close to it. Okay. Now here this. What is this? Pubic bone. What is this? What is this area called?
Fundus.
Fundus. What is this area called? Body of the uterus. What is this area called?
The neck.
Cervix. What is this called? Vagina. Vagina. And what is this?
Labius majoris.
Urethra. Okay. Okay. What is this structure? Ureter. Yes. Right? And this is the area for the renal organs. But rectum is not present in this model. Tell me about this. What is this? Blood. Blood. What is this?
Ureter.
Median umbilical ligament. That is related to the apex of the urinary bladder. Okay? Okay, urinary bladder. What is this? Rectum. Okay. What are these? Ureters. And what is this? Suspensory ligament is the structure in which it is present. This is the ovarian artery. Can you see this? See now. Ovarian artery. I told you through the suspensory ligament, the ovarian artery goes down. And from where the ovarian artery comes? From where ovarian artery comes? How many leg artery? You tell me. Ovarian artery.
Ovarian artery.
You.
Internal ilia كلها.
No idea? Have you done cardiovascular system or not?
Yes, we did.
Dramatic.
Have you attended by?
No, I wasn't with you. No, not with you.
I think you have done in the lectures also.
Yes,
Don't say like this. Anybody? It's a branch from the abdomen. Yes. Yes. This is the branch coming from the abdominal aorta.
بس انه اقرب شيء اقرب
And you people are saying that it is coming from the internal iliac artery or the common iliac artery. Very strange. What are the branches of abdominal aorta?
Common.
superior mesenteric arteries.
Huh?
Superior mesenteric arteries. كانت superior mesenteric arteries.
You?
Cephalic ganglion, cephalic cushion.
No idea? Yes, you are reaching to the point. I think you have attended the lab. Have you attended the lab? Have you attended the lab? No? How? Tell me, what is the way to describe the branches of the abdominal aorta? How would you identify? In plastinated. Because unfortunately we have plastinated specimens with us. If we keep plastinated specimens in your exam, what will you do? Make dua for us. Should have some concept. Sure, this is not the time to revise the cardiovascular system, urinary system, because how can I expect you people to identify these tubes? But you see, we have placed tag over here, none of it. What is the purpose? For you, for your exam. These are the previous tags. Still we didn't remove it, just to show you that these are the structures which are important. Okay. That's why I keep saying one thing. After finishing the lab, go to your home and revise the manual, at least the figure contents. What we people have described it to you, just go and revise the figures. So in this way you will retain the information. Otherwise that will be gone. We finished this model, okay? We finished? Anything remaining? I think we have finished all the aspects. What is this? Why you have identified it in the urinary bladder? Yes. This is the part of the urinary bladder which is devoid of peritoneum and it receives ureter. urinary bladder, not submural vesicle. Please be careful. This is urinary bladder. Why this is muscular like this? Why? What is this structure? Why it is shiny and why it is not shiny? Yes, that is covered by, superior surface is covered by peritoneum, but the inferior surface is not covered by peritoneum. This is the part which receives ureters, isn't it? Okay. What is this? What is this?
Could you show it from the
You remember the lesson? You think you have remembered the lesson? I told my students that if you find any difficulty in identifying from one view, just rotate it to see on the other side. See, this is prostate gland. When you rotate it, you will see the prostate. Same color, same size, same height. These are the techniques to identify the structures in the hospital. These techniques will work. So this is done. What is this? This one.
Bladder.
This is bladder.
Ureter.
Ureter. This is ureter. What is this white layer? What is this? Peritoneum. Yes. This is peritoneum. Utrovesical pouch. Have you read it in lectures? Utrovesical pouch. This is the pouch of the peritoneum. What are these structures? 1, 2. No. This one. 1 and 2. I'm not talking about this. What is this? What is this? If you may mark pointer away. What are these structures? 1 and 2.
Cervix.
Fornix is this one. What is this? Vagina. Okay. This is urinary bladder. This is uterus. This is rectum. What is this?
Uterus. Peritoneum and uterus.
Peritoneum? Too thick. Which it could be. Anyone? Vagina. This is vagina.
Where is it? Doctor, what is it?
This is uterus. This is vagina going to open into the external genital. See the relation. See the relation. These are the ureters. In front of the vagina, they get open at the bale area, inferior surface of the urinary bladder. This is also done. What is A? What is A? Just a quick revision. Fallopian tube. Excellent. What is this area? Submucous vesicle. Okay. Okay. What is this?
Cubicle.
What is this? Urethra. What is this? Vagina. Labium minus. Labium major. Okay. And look at that. Yes. What is this?
Urethra. Just a
Vase difference. This is vase difference. This is the internal inguinal opening. Deep inguinal ring.
Where's the urethra?
This is deep. This is the superficial. In between inguinal canal. Campaniform plexus. What is this? What is this? Epididymis. Why I am showing you all specimens? Because maybe at the time of selection, maybe we select this one due to shortage of models. So that's why I am covering all. So this is epididymis. What is this? This area is testicle covered by tunica albuginea. Testicle, testis. This is epididymis. What is this? What is this? Vase difference.
This is not the epididymis?
This is epididymis. This is vase difference. Okay.
The green one is the urethra.
Urethra is this one.
And
This is vase difference. See the color. Match the color. Beige color. Also beige color. Got it?